Firstly, as I was saying with meditation, firstly, I use it.
Yeah,
Because
walk the talk.
Exactly. I ideally want to come to a therapy session regulated, but also able to re-regulate in the session. So I use breathwork a lot in session and before session, and so my practice. But then, of course, it's a tool. I want my wish is my client at some point become independent. They don't need me or anybody else somehow any longer, or any other substance. So I definitely use it. I do a lot of psychoeducation, breath education with my clients, and when I can, and when it's useful, because any tools can be an obstacle to the relationship. So it's not just use it all the time. But with some clients, so often within the client work with a client, I offer breath work. Definitely a very fundamental tool. I'm saying that it's a tool in therapy. So like any tool, it can be misused. And I'm thinking of the wonderful example that Piero Ferrucci gives in his The Power of Kindness, where I don't know if you've read the book, but anyhow, at some point it describes a psychiatrist that is working with an autistic individual for many years, severely autistic, so nonverbal. And of course, the communication is quite difficult, but there is a lot of empathy, compassion, and a relationship is built after many years. And at some point, the psychiatrist has an intuition, takes a pencil and throws it the other side of the room and asks the patient, could you please get it for me? And incredibly, the patient understands, goes and gets the pen and brings it back, which was quite a breakthrough in the therapy. And so in a conference, this psychiatrist recounts this event and says something has happened. And after that, there is a number of psychiatrists that throw pens at the autistic clients, right? So that is a badly used tools. So tools, it's contextualize. I wouldn't sit with a client and the first thing I tell them, you just do breath work. Yeah. So it's
so you're guided by your, sorry.
It's within a relationship.
Yeah. You're guided by your intuition, and there is a lot of research now showing that the meditation and breath work really develop people's ability to be in touch with their feelings, which is the major I think obstacle sometimes in therapy, because we are so in our heads. We are. I'm talking about my own experience when I first came to therapy. I was asked how I was feeling, and I would always give a very practical answer, and be in the relationship of how you're feeling and how what's going on for you. And we know now that breath work and meditation facilitate that. So it's like the soil is more prepared for meditation. Also, what you said at the beginning about therapy, is not the only way, but in combination, which it was with Assagioli, was advocating that we use our own spiritual practice and our own tools for well-being to connect with the self. And
I mean, the connection between breath and emotions is very well known. No? I mean, if you're sad, you cry.
If you're tense, you hold your breath.
Yeah, if you're happy, you laugh. There's a particular type of breath. If you yawn, you're relaxed. You breathe in a different way. The connection with some fundamental aspect of life and breath. Pregnant women, when they give birth, the breathing changes dramatically. So there's everywhere. There's a lot in literature. There is a moment in the Odyssey when Ulysses goes back and Homer describes the different breathing of Penelope when she realizes that this is Ulysses coming back, and everywhere there is a connection. Also in I think it's the Ramayana, where there is the monkey god that uses breath to become huge, like a mountain, in order to be able to cross very long distances. That also gives a suggestion that breath work can enhance some of our capacities, which is definitely true. But I was saying that since we know that there is a connection, automatic connection between breath and emotions, then it is also true that we can do the top-down version, to have a conscious use of breath to then instigate some emotions.
Okay.
That is the whole point.
So you can breathe in a way that will make you happy.
Yeah, there are a lot of graphs. There's a lot of research that shows that fear has a particular breathing pattern, joy has a particular breathing pattern, meditation has a different breathing pattern, anger has a different. So, since there is an automatic correlation, equally you can use particular breathing pattern to instigate a different state of mind. And this is like, there's a book on meditation that is called Altered Traits, but like breathe with meditation. So equally with breathing, there is a difference between altered states that you can achieve with a client, meaning a client comes with a anxious state. You help them to breathe using the diaphragm, and after a few minutes, you have instigated the parasympathetic nervous system, and therefore they reach a state of calmness. Then they go out of therapy, and something happens, and they go back to anxiety. So also, you might recommend a practice of breathing so that it's not just a state change, but a trait change. You want the individual to shift in their life, not just in sessions with you. So this is a more ongoing practice that you might suggest the clients, so not just with you.